Hey there. I have not done a COVID science update in a while, so I thought I would look at some new research and give you my generalized thoughts. I'd like to do more of these on a regular basis. So today I went into the Lit COVID because I like to see what's happening, and it gives me the newest articles. So I found an article, the seroprevalence of immunoglobulin M and G antibodies against SARS-CoV-2 in China. And it specifically notes that they looked at cohorts in and around Wuhan. So I was definitely interested in this article because I am very curious about seroprevalence. I've definitely been one of the people who has wondered if things were able to spread a little bit more, if it would improve the overall immunity and things like that. And so getting an understanding of how the immunity spread in Wuhan is useful. Now, Wuhan did get locked down, and it did get locked down fairly quickly. So this does give you a sense of what it's like under those conditions, but I was curious, so I decided to take a look. So seroprevalence of immunoglobulin and M&G antibodies. It has the full paper, and it is published in Nature Medicine. It is a brief communication, so it doesn't have absolutely everything, but there are things that I can look at. So first of all, it is a test for antibodies. So tests for antibodies are not perfect yet. We're not great at them. They have large-scale confidence intervals in many cases and things like that. And so I did note that they tested the antibodies on essentially serum that was from prior to the outbreak, and that mostly it was able to avoid picking up too many false positives, but it's still important when going through to examine the confidence intervals. So as it notes, assessing the cumulative prevalence will help our understanding of the epidemiology of the outbreak. So long and short of this article is that when you get to the point where you're looking at it, first of all, people who definitely tested positive for COVID definitely experienced antibodies, and at about the ways and rates that were expected. So it notes that the cumulative prevalence was 44 and 56% for the each on day 7 after the onset of symptoms, which is about right because that's when the immunity is building, and had reached over 95% on days 20 and 16, which makes sense. So we do build up antibodies when we have it. But the real question was, what was it affecting in the population? One of the things I like about this study is that their demographics are that they were actually looking at people who might have been exposed. So they picked up healthcare workers, patients in various hospitals, people who worked at hotel staff where I think something occurred, and healthcare worker relative. And then they also have community resident and factory workers. So these are people who would have been outside of the realms. So let's look at these numbers. So the IgG, IgM prevalences are real low. Let's be real about this. Even in hospital settings, healthcare workers in Wuhan, we are talking about less than 4% of the population showing antibodies. That's not a lot. And these are people who are likely to be exposed. So we know there's asymptomatic transfer. That's not a question. But is there enough asymptomatic transfer that even people in high level sort of situations where they should be exposed are getting exposed highly? No. Interestingly enough, no. So I have to say that if I've been wondering if more of opening up and trying to get things to spread is going to work, these numbers suggest that possibly not, because these are people who should have been exposed and did not. Now, they all took very good precautions. So I will note that in previous studies, I've seen that healthcare workers wearing masks almost never get it. So this study could tell us a couple different things. It could tell us that all of the precautions are working extremely well, which is good. That's definitely the way it should be. But it also tells us that in a general sense, there's not a lot of this extraneous transfer going on once things slow down, which is both good and sort of concerning because it means it's going to be harder to tell what's happening as things open back up. But it does mean that all of it is working pretty well to slow it down. So what does that mean for us? I mean, it can mean a number of different things. The concept that we're going to be able to completely stop this is still kind of up in the air. Whether or not we're going to have to wait 18 months until there's a vaccine to have normal lives is still up in the air. It doesn't seem like we're going to get a lot of spread. So like right now, I'm living in upstate New York. We're not near a major outbreak center, and most likely, most of us haven't been exposed to this under any circumstances unless you are working in one of these sort of high risk type areas. So in our area, that's definitely nursing homes. We have a lot of our cases have come from there. And now they're doing more testing there, which is good. But what can we do? Well, one of the things that this tells us is that we are doing a good job of keeping it contained. What that really means is that catching it and contact tracing are where the keys are going to be. Because if it's not doing as much extraneous spreading because of keeping things closed down, the best things we can do is, as things slowly start to open up, is catch cases of it as quickly as possible, backtrace them to the people who would be likely to pass them. It does seem to pass in very particular, unprotected circumstances. Now, I mean, there's circumstances that we're in a lot, especially during winter when you are enclosed in spaces with people and stuff is just recirculating. But there's a chance that over the course of summer, we can get that R value, the number that it passes to other people, down below 1. It means every time we catch a case, we can try to catch it and backtrack it. It's still hard. There are still people who are symptomatic for days before, so you have to do a lot of contact tracing, more than would be normal. There are still asymptomatic people because there is evidence of that. It's a little hard to gauge what the percentage on that actually is. I need to look up a paper on somebody who's done a really good widespread study of this kind of thing, but in most of the sero studies I've examined, the numbers are low like this. And I know at one point New York tried to suggest that seropositivity was in 20% of cases, but I have some concerns with a lot of their sampling and things like that. So I still don't think we have good data saying a lot of people are currently carrying antibodies and have been exposed. My expectation is, for example, I have not been exposed and therefore could still become a carrier at some point in the future. So this isn't like bad news, but it is important to note that we are not going to reach herd immunity on our own. And that is an important concept. So remember that when you're thinking about things. I'm going to try to do more updates like this. And if you have specific COVID topics you want me to research and give you my scientific opinion on, I'm glad to do so. Which, as a reminder, this is my scientific opinion from my background. I'm not an epidemiologist or a virologist. My background is in microbiology, but mostly environmental. But I can think through things and I can tell you what I'm thinking and why. And I think that's the key part of science. So, hey, hope you learned something.